I had the gastric sleeve surgery. The reason was I'm overweight, and being overweight, I didn't have any previous health conditions or health conditions now other than being overweight. So at 42 years old, I was wanting to prevent health conditions in the future as I age by having this gastric sleeve process done.
We've had other patients coming in from the US for laparoscopic surgery, but Miss Amanda was the first bariatric patient. The first time I met her, I think she was all bubbling with anticipation. She was motivated, and I knew straight away that she was a really good candidate for this procedure. I think it's my personal belief that the patient's attitude, all of these are very important in the patient's outcome, no matter how good a job you do as a surgeon.
I found out about Health City through Indus Health. The company that I work for uses Indus Health to get needed surgeries for its employees at a better value. The facility's beautiful, it's brand new, it's on an island, which you can't get a lot better than that. The doctors, Dr. Ranga, after he and I first had our conversation over the phone, I was very convinced that he was going to be a good surgeon for me. Even though this is my first surgery and he is my first surgeon, he was just very, very considerate, and he answered every question that I asked very honestly. I didn't like a lot of the answers, so I knew that he was being very honest.
So basically the surgery involves reducing the size of the stomach. So patients feel full even after eating just a little bit or drinking a little bit, because we reduce the size of the stomach. Yeah? So 80% of the stomach is removed. So it turns out she lost 1 pound per day. So I saw her on day 8 after surgery, and she had lost 8 pounds. Usually sleeve gastrectomy will give you a weight loss of 100 pounds at least, maybe a little more. But that's variable. It again depends on the patient's original weight.
I'm very happy with the outcome. I've had no problems. I would recommend it to anyone who is looking for bariatric surgery to come here, because the care that they gave me was extremely, extremely top shelf.
So we advise them on a strict diet. We have dietitians who are tuned towards this bariatric diet, and so they will immediately from day 1 take over the dietary part of it, and they will visit the patient twice a day and tell them what to eat and how to eat.
Brandy, my nutritionist, will contact me every month, at least for the first year. She said to keep me on track and to make sure that I succeed with this whole process. I would do it again. I would do it again, because this was a great experience. It really was. If anything comes up in the future, say if I have a shoulder go out or if my heart goes bad or something happens, I would come here again. I would have this team of people take care of me any day.